I think about 107 have logged in right now.
Yes, 107. Correct.
Madam, your voice, have you muted?
I had muted, sir, because...
Okay.
Do you come to Bangalore, sir? Oh, okay, later. That's why I muted.
We can chat actually.
Dr. Joshi?
Yeah,
Can we see the list of participants? No. Unlike in Zoom, we can see list of participants.
No, we can't. And there is no disturbance at all from anyone. If you need, I can send you the PDF file later. But right side, you can see the chart box.
Sorry?
You can see the chart box. In the chart box, you can see the... And you can also see in the attendees. If you click on attendees, you can find the number over there. Here you can see their names also.
Right.
The right side you can see them.
You see?
Yeah, we can see them each one.
We can see their names. Can we wait for 2-3 minutes, Dr. Somnath?
Yes, sure.
Yeah, because people are joining.
ಇಲ್ಲಿ 4 ಸೀಟ್ ಸರ್. ಇದು ಸ್ಟೇಜ್ 4 ಸೀಟ್ ಅಷ್ಟೇ. ಬೇರೆ ಯಾರು ಸ್ಟೇಜ್ ಮೇಲೆ ಹೋಗೋಕ್ಕಾಗಲ್ಲ. ನಾವೆಲ್ಲ ಕೀಳ್ಗಡೆ. ಹೌದಾ? ಯಾವ ಸ್ಟ್ರೋಕ್ ಸ್ಪೆಷಲಿಸ್ಟ್?
Darshan, where is this gone? Link.
Copy the link.
Copy link address. I'll it go back now. Keep it ready.
Only on YouTube. ಮತ್ತೆ ಆಗಲ್ಲ. ನಾನು ವಿಡಿಯೋ ಇಲ್ಲ ಆನ್ ಮಾಡ್ಕೋಬೇಕು. ಏನು ಬೇಡವೋ ಆಮೇಲೆ ಡಿಲೀಟ್ ಮಾಡಿ. ಯೂಟ್ಯೂಬ್ ವಿಷಯ ಮಾಡ್ಕೋಬೇಕು.
Good morning, everybody. Myself, Dr. Purnima, Deputy Director of Field Outreach Bureau, Mysore, heartily welcome you all to the webinar titled Impact of COVID-19 on Geriatric Health, Alzheimer's and Dementia. Geriatric health is of prime concern with regard to dementia-associated diseases such as the Alzheimer's disease. Dementia, a syndrome characterized by deterioration in cognitive function, affects memory, thinking, orientation, comprehension, calculation, learning capacity, language, and judgment capacities of an individual, implying a severe impact on the person's social well-being and independence. Such disorders are mostly age-related. Good geriatric health care is imperative, particularly in the current times of pandemic. Utmost care must be taken towards both prevention and cure of individuals with such conditions. In this regard, today we have experts from the domain to educate us on handling the same during COVID-19. I request Dr. Hanumantachar Joshi, Principal of Sharda Vilas College of Pharmacy, Mysore, and the President of RC to welcome and introduce the experts to our participants. Dr. Joshi, please.
Very good morning, and thank you, Dr. Purnima, for associating with us and for giving an opportunity to RC to conduct this program. And I'm very happy to say, not only from India, we have people from across the world also joined for this, a few people. And it's really my pleasure to introduce Dr. Somnath Vasudev. He graduated from Government Medical College, Trivandrum, and he completed his post-graduation from Government Medical College, Trivandrum. I hope I am audible.
Yes.
Yeah. And his super specialty training in neurology from Government Medical College, Calicut. He is heading the Department of Neurology at Apollo BGS Hospital in Mysore, which he started and built up in 2002. And he is the person instrumental in starting this department in Apollo BGS Hospital. And he has been instrumental in starting the acute stroke treatment, which is one of the best in Mysore, and I can say one of the best in Karnataka also. And it is having the largest number of patients having had thrombocytic therapy in Mysore. He has also set up the state-of-art neuroelectrophysiology laboratory in Apollo Hospital, Mysore, and his special interests are stroke treatment and epilepsy, and other interests are music. And he's a very good singer also. But today is not here to sing. He is going to deliver a talk, and we are highly thankful to Dr. Somnath Vasudev from RC because he is our medical scientific advisor from Mysore chapter. So with this, Dr. Somnath, a very hearty welcome to you. And before Dr. Somnath takes up, I would like to introduce Dr. Suvarna also at the same time, so that we can minimize the time, in the next talk. We have one more very interesting and eminent personality, a researcher and a doctor who has been doing wonderful contribution for the field of Alzheimer's and dementia. Because many people say there is no much, the remedies for Alzheimer. It is very challenging for any doctor to take such an area for research and doing their good for the welfare of society. And Dr. Suvarna, she is a professor in neurology, National Institute of Mental Health and Neurosciences, which is known as NIMHANS in Bangalore. She was a Commonwealth Research Fellow in Cognitive and Behavioral Neurology at Cambridge in UK in 2004. After returning to India, she established one of its first memory clinics in Hyderabad. Please note, she is the first person to start memory clinic in Hyderabad. And it provided multidisciplinary care to more than 2,000 patients with dementia, recognizing the limited availability of diagnostic tests for dementia in diverse contexts. Dr. Alladi is coordinating a multicentric study that adopted cognitive tests for different Indian languages and for literates and as well as illiterates. Her group work in dementia focuses on investigating complex influence of life course experiences, especially bilingualism, education, and social engagement to understand development of risk and resilience against dementia. In the background of a rapidly rising burden of dementia, creating awareness and organizing community support for dementias became a focus of the NGO she co-founded in Hyderabad, which is known as RC Hyderabad. She is well associated with that, but she is presently working at NIMHANS in Bangalore. She has also made a lot of effort to represent priorities of the less developed societies in international platforms and meetings. She is a LMIC representative of Vascular Professional Interest Area Group of Alzheimer's Association, and she is the president of World Federation of Neurology Research Group on Aphasia and Cognitive Disorders. So we are very happy to have Dr. Suvarna here, and we will be very happy to listen to her. And thank you for sparing your time, especially Dr. Somnath. Disturbing him on a Monday is really, a Herculean task. Thank you for accepting invitation, sir. Please, it's all yours.
Thank you.
Yeah, Doctor, before we start, I think we have a small clipping from Niti Ayoga, which will be played right now. This is on Corona. Just a moment, sir.
नए वक्त में अस्पताल जाने के नए नियम। जब भी आप अस्पताल जाएं, तो पहले डॉक्टर से अपॉइंटमेंट घर से ही लें और समय अनुसार ही घर से निकलें। ऐसा करने से आपका समय बचेगा और अस्पताल में भीड़ नहीं लगेगी, जिससे कोरोना का संक्रमण होने की संभावना कम होगी। अपनी और दूसरों की सुरक्षा के लिए अपने साथ अपनी कोविड सुरक्षा किट यानी मास्क, सैनिटाइजर, पेन आदि ले जाना ना भूलें, ताकि आपको पेन, सैनिटाइजर जैसी चीजें दूसरों से लेकर इस्तेमाल नहीं करनी पड़े। इससे आप कोरोना के संक्रमण से अपने आप को और दूसरों को बचाएंगे। ध्यान रहे, अस्पताल में अभी सिर्फ 2 लोगों के ही प्रवेश करने की अनुमति है, इसलिए मरीज सहित केवल 2 लोग ही अस्पताल जाएं। मास्क पहनकर ही घर से निकलें
ऐसा करने से अस्पताल में भी बचेगा और अस्पताल में भीड़ नहीं लगेगी।
सावधानी को आदत बनाएंगे, कोरोना को मिलकर हराएंगे।
अपनी और दूसरों की सुरक्षा के लिए
Thank you, Doctor.
अपने साथ
I think Dr.
अपनी
Vasudev
कोविड
can...
सुरक्षा सैनिटाइजर जैसी
Can you start now?
Yes, Dr. Vasudev can take on.
Can I start?
Please, sir.
Please, sir.
Thank you very much for inviting me to this webinar. I'm really grateful to Dr. Purnima as well as Dr. Hanumantacharya Joshi for inviting me for this. And thank you very much, Dr. Joshi, for that very nice introduction. I will straight away start my presentation. Basically, I am going to start this webinar with an introduction on the neurological manifestations of COVID-19. Today's topic actually being more on dementia, on which one of the best experts on dementia, Dr. Suvarna Alladi, will be talking about. So this is just an introduction on how the COVID-19 affects the nervous system. The coronavirus, it's a very highly transmittable and pathogenic viral infection caused by severe acute respiratory syndrome coronavirus called as the SARS-CoV-2, which is now called as the COVID-19 because it started in the year 2019. And it emerged in as we all know, from China, and bats being the primary reservoirs. They are very minute, very small sized RNA viruses, subgroups of which we have got the alpha, beta, gamma, and delta. The coronavirus actually presents as a severe acute coronary respiratory syndrome, and the predecessors to this coronavirus are the SARS-CoV, H5N1 influenza virus, H1N1 2009, and Middle East respiratory syndrome coronavirus, the MERS-CoV, which all cause an acute lung injury. So basically, the most important the primary organ that is affected is the lungs, and which leads to pulmonary failure and results in a lot of fatality. Though other organs are also affected, the primary organ is the lungs. And prior to this pandemic, we have had epidemics, the SARS-CoV, which happened in 2002 in China, and then later on 2014 to 16, the MERS-CoV, which started in the Middle East countries. The novel coronavirus, the present virus called as the COVID-19, originated from the Wuhan city in China in December 2019, where they reported unusual cases of pneumonia with an undetermined etiology. Initially, all cases were clustered to a seafood wholesale market in Yan'an, and later on, after much deterring, the World Health Organization declared it as a pandemic on 11th of March 2020. As of 17th July 2020, there are more than 14 million confirmed cases of coronavirus, with almost 6 lakh fatalities all across the world. This is the structure of the coronavirus. It's being called the coronavirus because it resembles a crown, and that is because of the spike proteins on its surface, which is an RNA virus inside the envelope glycoprotein, on which there are protein molecules. And then it is transmitted either from the bats, via civet cats, and several other intermediate hosts, and then we get it, the humans get it from these from close contact with these animals. How it enters the cell, host cell, is that it attaches to the ACE2 human ACE2 receptors, the angiotensin converting enzyme receptors, and it is internalized into the cell, and it enters the cell. And once it enters the cell, it starts multiplying, and then once it starts multiplying, and it gets its own coat, and then it enters the bloodstream. So this is what happens. Now, the most common symptoms are fever, a dry cough, and tiredness, very severe myalgia. Other symptoms that are less common may affect some patients include aches and pains, nasal congestion, headaches, conjunctivitis, sore throat, diarrhea, loss of taste or smell, or a rash from the skin. These are usually mild and begin gradually. Some people become infected but have very mild symptoms, and some of them remain asymptomatic too. That's what's most dangerous for us. Most of these patients, about 80% of them, recover from the disease without needing hospital treatment, but about 20% become very severely ill, develop severe breathing difficulties, and they go through a very stormy period in the hospital, requiring ventilation and all those things. And then especially those people, the elderly people with a lot of other comorbidities like high blood pressure, diabetes, heart and lung problems, cancer, and any other major illnesses are at a higher risk of developing complications and serious illnesses. And those people who develop difficulty in breathing, shortness of breath, chest pain, or loss of speech, or should immediately seek medical attention. Now, the investigations how to diagnose a case of COVID-19 is currently the laboratory diagnosis, which is most sensitive and specific, is the real-time reverse transcriptase PCR. That is what is called as an RT-PCR test, which tests the samples like swab from the nasopharynx, or even fluid which is taken out from the lungs through a lavage, like a bronchoscopic lavage. So any of these samples is sent for a reverse transcriptase PCR test, which is very sensitive and specific. The antigen, the rapid antigen and antibody tests are also there, but they are less reliable. That means if you have an antigen test which is negative, it doesn't mean that you do not have COVID-19 infection. You have which can present with headache. Headaches are basically because of vasodilation of the